The measles outbreak in Philadelphia is officially over, but now there's another virus sweeping the Delaware Valley. Hello, I'm Stephanie Stahl, and welcome to Health Watch here on CBS News Philadelphia. Coming up, we'll take a look at how a stomach bug is causing disruptions in the classroom, and later find out who's stepping up to put a stop to a troubling trend affecting Black women. Let's get started.
Well, you might have heard or possibly dealt with it. The stomach bug is going around.
That's right. More and more students and teachers have been calling out sick with the norovirus. CBS Philadelphia reporter Eva Anderson has more now on how it's impacting schools.
Here at KO12 Kids, between their school and their daily camps, they serve about 150 kids every week. And unfortunately, recently, a lot of those kiddos and even the staff have been getting sick.
At KO12 Kids, the little ones have a lot of fun. Nowadays, there are just fewer in the building.
We have kids and or teachers out every single week recently for at least the last few months.
Sharon Hirschman is the founder and CEO of the school that serves pre-K through early elementary and also offers a day camp and after-school care for even more kids. And even though they were open during COVID, she says this is the worst dip in attendance they've experienced.
I've been in this business for 16 years, and we have had more illnesses in general this year than I've ever seen.
She says students and staff have had everything from COVID to influenza to the nasty norovirus recently, which the CDC reports has been making the rounds across the U.S., spiking here in the Northeast in February.
It's a really strange stomach bug because it's showing a lot of different symptoms.
A spike in norovirus cases has not affected the attendance here at the Please Touch Museum, but museum staff say they are working extra hard to keep your whole family healthy.
We have always had deep cleaning, high-intensity cleaning. When we closed for the pandemic, we actually already had the air filters that they were recommending that you have.
And multiple times a day, cleaning staff sanitize props with medical-grade hygienic equipment. They also encourage kids to use hand sanitizer between frequent hand washing. The steps doctors say are the best ways to keep the virus from spreading.
We try to encourage people to be clean, squeaky clean.
Hand washing is also a top priority back at KO12 Kids School, after the bathroom, before they eat, and when they arrive.
They wash their hands as soon as they get here.
Knowing the best way to keep kids learning is to first keep them healthy. Eva Anderson, CBS News Philadelphia.
Well, you know, it is still flu season, and the symptoms between the flu and norovirus can, on the surface at least, appear similar, but there are some big differences. Even though norovirus is referred to as a stomach flu, it's technically not a flu. The flu is a respiratory infection that more resembles a cold. The norovirus is going to come with more gastrointestinal issues. Depending on how severe the flu is, bouncing back takes much longer compared to norovirus. It might take 5 days, even longer, before you start to improve. Compare that to norovirus, which doctors say takes about 24 to 48 hours to resolve. Now, chances are, if you're not dealing with this, then you know someone who is at this point. Head to our website, cbsphiladelphia.com. We've got a full list there of ways to protect yourself from norovirus.
Philadelphia's health department says a recent measles outbreak is officially over. A total of 9 people tested positive for the highly contagious virus. It all started with a young patient at Children's Hospital of Philadelphia and later spread to a West Philly daycare. 6 weeks have now passed since the last new case, so health officials say the outbreak is over. We're told everyone has recovered.
Warning before you use mouthwash. One brand is being recalled nationwide because it could poison children. According to the Consumer Product Safety Commission, Heritage Store hydrogen peroxide mouthwash, it lacks child-resistant packaging, which is required for products that contain certain levels of ethanol. Over 100,000 bottles of this mouthwash have been recalled, including both the eucalyptus mint and winter mint flavors. Now, the manufacturer is offering refunds or replacements.
Several brands of lubricant eye ointments are being recalled due to a risk of eye infection. Federal inspectors are blaming unsterile conditions at a plant in India where the products are manufactured. The brands affected include Equate, CVS Health, and Lubricant PM. Those who have the ointments should stop using them immediately and return them to the place of purchase.
A new national survey reveals surprising data when it comes to risk factors for colorectal cancer.
CBS News correspondent Michael George has the new information out there that young adults need to know.
Will Triplett is an Ohio restaurant owner and busy dad of 2. In 2019, he began experiencing rectal bleeding and discomfort. It worsened, and months later, he received some devastating news.
It was stage 3 rectal cancer.
Triplett was just 43, younger than the recommended age of 45 for a colonoscopy.
Busy, active lifestyle. Didn't always have the best diet, especially in my younger adult years.
A new national survey from the Ohio State University Comprehensive Cancer Center of 1,000 adults found while most people know family history is a risk factor for colorectal cancer, they lack awareness for other factors. Less than half know alcohol use is a risk factor. 2 in 5 don't know a lack of physical activity can play a part. And more than a third are unaware that obesity and a diet high in fat and processed foods are risk factors. Dr. Matthew Kalady, who treated Triplett, says the uptick in colorectal cancer among younger Americans is concerning.
One of the things that we do think it's related to is probably consumption. People nowadays, unfortunately, based on our society, there's a lot less physical activity, particularly in some of the younger populations.
Doctors emphasize colorectal cancer can be cured if it's caught early and prevented through regular screening. Triplett's kids will start getting colonoscopies at age 35. He's urging everyone of the recommended age to make that appointment.
There's really no reason to worry. They're easy.
Triplett adds it could potentially save your life. Michael George, CBS News.
Well, a retired accountant in Lawrenceville, New Jersey is crediting his smartwatch with helping to save his life.
He had no idea he had a heart problem, but he's certainly glad he had the heart rate app activated on that watch. CBS News Philadelphia health reporter Stephanie Stahl has his story.
I want it to be cool. I always thought that these were really sharp looking. They're hip, they're in style.
They're trendy, all right, but for Frank Haggerty, his Apple Watch became a lifesaver.
My wife and I were sleeping, and the alarm went off on the watch.
The alert said his heart rate was too low, reading about 30. A normal pulse is between 60 to 100 heartbeats per minute.
So they put me in an ambulance and they rushed me to the hospital.
The emergency department doctor was shocked. The 73-year-old from Lawrenceville had no symptoms.
He says, "You don't feel lightheaded? You don't feel like your chest hurts? You have nothing wrong?" I said, "I feel like I could run a marathon." And his response was, "Well, you might make it to the end of the hall."
Frank ended up getting a pacemaker to regulate his slow heart rate. His cardiologist is Keith Wolfson with Capital Health.
Well, he wound up having what was called complete heart block, which is an electrical phenomenon in the heart where the heart's intrinsic electrical system malfunctions.
I'm pretty damn lucky, is what I think.
How reliable do you think these watches are for something like this?
Pretty reliable. As with any new technology, there are bugs that need to be worked out.
Frank, who's back to exercising, has a new appreciation for his cool technology.
See, I'm approaching a world's record. Quite frankly, had I not had the watch on, I wouldn't be sitting here today.
So what do you think about this watch now?
I think it's fabulous. My best friend now. I hate to say that in front of my wife.
With his heart now regulated, Frank and his wife can focus again on puzzles and enjoying their life together. In case you're wondering, Frank has a Smartwatch SE. Recently, there was a government study that found the accuracy in detecting heart problems was high. I'm Stephanie Stahl, CBS News, Philadelphia.
2 new micro-hospitals are coming to Delco. Christiana Care didn't say exactly where, though, the neighborhood hospitals will be built, but we're told they will be open 24/7, have a full-service emergency department, and a few inpatient beds. Christiana is already building a similar hospital at the old Jennersville Hospital in Chester County. The new hospitals are scheduled to open next year.
Don't go anywhere. We will be back with more Health Watch here on CBS News Philadelphia. Welcome back to Health Watch here on CBS News Philadelphia.
The first patient in the world to test a new treatment for melanoma is now incredibly cancer-free. The research from MD Anderson at Cooper was just approved by the FDA.
Health reporter Stephanie Stahl has the first interview with that patient.
This new therapy for melanoma, a deadly kind of skin cancer, is being called a remarkable success.
I had no idea that I was going to be the first person in the world to be on this.
Deborah Marsdale can now see the future after being the first to try a new therapy for metastatic melanoma.
I mean, it's pretty amazing. Patient number one and complete responder.
Dr. Young Ki Hong, a surgical oncologist at MD Anderson at Cooper, says her cancer is gone.
This is a very exciting time for everyone.
This therapy uses the patient's own cancerous tumor to remove and revitalize T cells.
That is essentially comparable to bone marrow transplant, but with cancer-fighting T cells.
His research showed that TIL cell therapy, traditionally used when other treatments fail, can be successful as the first line of treatment.
Under the belief that your body can truly heal itself, we just need to help it. If this trial is successful, we will now be able to enroll patients in cell therapy as a first-line treatment, and that will give them the highest chance of beating this cancer.
Deborah says the 16 days of infusions were grueling, but worth it.
I wish it was a lottery ticket. It's not, but it's a lottery ticket for life.
Ironically, her husband had another kind of aggressive skin cancer.
I'll never forget my daughter shaving my head in the hospital and saying, I can't believe I'm shaving my second parent's head in 2 years.
Her husband didn't survive. That motivated Deborah to try something new.
I was still numb from my husband's experience.
She hopes the therapy that saved her will spare other families the agony of cancer loss. Forever grateful to the medical team that's keeping her family together.
Yeah. Doing all right?
Yep, I'm doing great.
And Dr. Hong says now that the FDA approved the therapy, it will now be available as the first line of treatment for melanoma patients. He says that will be a game changer. We have a link for more information for you at cbsphiladelphia.com. This therapy also has application for lung cancer. So
wow.
It is the future for sure.
Indeed, like you said, a lottery ticket for life. That's beautiful. Thank you, Stephanie. Good stuff.
Good news.
A new study finds that annual breast cancer screening starting at age 40 saves the most lives.
Yeah, researchers from Dartmouth reviewed the outcomes of different scenarios, including screening every other year and also screening starting at age 50. They found annual screenings beginning at age 40 lowered the risk of death by 41%.
Well, it is not a new danger, but despite efforts to raise awareness about the risks of TVs and furniture tipping over, thousands of kids are going to the ER every single year, according to a new report.
And health reporter Stephanie Stahl joins us now with more on this new research.
Yeah, very concerning what this report says. The Consumer Product Safety Commission says it is not just kids being hurt by furniture that tips over. This research also says there are ways to avoid the danger.
Take out all your jammies.
It can happen in an instant. Curious children climbing on furniture with dangerous consequences.
When you have something that's heavy falling on a child, it can result in death.
In a new report, the U.S. Consumer Product Safety Commission says nearly 18,000 people are hurt in tip-over incidents every year.
Children are impacted more than anybody else. So over the last 10 years, there have been over 200 deaths associated with tip-overs.
Of those deaths, the report says nearly half involve a television, and more than half of those involved are children between the ages of 1 and 3. Others are at risk too. The research shows more adults ages 60 and above are also being sent to the emergency room after furniture tip-over accidents. All clothing storage furniture manufactured after September 1st, 2023 has to meet updated safety measures laid out by the CPSC. But no matter when your furniture was made, the agency says it should be anchored to the wall.
You go to the hardware store and for less than $20, you can go back and anchor it into the wall in about 20 minutes.
The website anchorit.gov has step-by-step instructions and videos on how to secure furniture to help prevent a tragedy. Now, last month, the Consumer Product Safety Commission recalled millions of anti-tip-over kits manufactured by New Age Furniture. We have all the information you need at cbsphiladelphia.com. Have to be careful with this because kids will be everywhere.
Oh my gosh, alarming to see that video too. Yeah, thank you so much, Steph.
A new study shows that grandparents can have a positive influence on a mother's mental health. That's especially when mothers are separated from their own partners.
Researchers from Finland found that mothers were less likely to use antidepressants if their own parents were younger than 70, still working, and did not have any health problems. Moms with older parents or in-laws in poor health were more likely to use antidepressants.
Well, black women having babies are at an increased risk of death, according to the CDC.
Well, that maternal mortality has a growing number of black women turning to doulas now. Health reporter Stephanie Stahl joining us with more on this trend, Steph.
That's right. Interesting new trend here, guys. You know, more black women are using doulas in an effort to overcome disparities in health care. Natasha Brereton is a busy mom of 15-month-old twins. When her girls arrived early, a group of doulas stood by her side during labor and delivery.
Hiring a doula is not just, a thing, like you just pay someone and they move on. She's forever in my life.
Doulas are not medical professionals. Instead, they provide physical and emotional support before, during, and after childbirth. According to the CDC, black women are 3 times more likely to die from pregnancy-related causes than any other group.
We have to have some policy change.
Brandy Bishop is with the National Black Doulas Association. She says birth disparities are system-wide.
At the baseline, it just has to do with racism. The system that we have treats black and brown bodies the same way that it always has.
Bishop says solutions include awareness and education, plus
we need people to really make change on a government level when it comes to how black and brown women are treated inside of these hospitals.
Natasha considers herself lucky. When the twins arrived, her personal doula stayed with her in the hospital for 3 days.
So it's really rewarding to me in my heart that I'm able to be in these spaces.
I wish there were more black women who understood that there's other things that you could do to not just allow the status quo to make you another statistic.
Natasha encourages other mothers to do their research. Now, most health insurance companies do not cover doula services because they are considered non-essential, so payment usually comes out of pocket. But women who do use doulas say they can be really helpful and supportive.
Yeah, it seems like it made all the difference for that family.
Absolutely.
Thank you, Steph.
A lot of special birthdays were being celebrated on Leap Day Thursday. Virtual Voorhees Hospital held a party to welcome their little leapsters, and there were a lot of them. Here's CBS News Philadelphia health reporter Stephanie Stahl.
It only happens every 4 years, and this Leap Day at Virtua Hospital in Voorhees was busy.
This is Amayas Parker, and that is Eris Parker.
The Parker twins among a big batch of Leap Day babies.
We're happy that they're here. That's the most important part. It's unusual, but they're here.
Babies born on February 29th are called leaplings, and there were plenty of celebratory toy frogs leaping for joy in recognition of the newborns.
We were hoping for it because we thought it'd be fun for him.
Andrea and Mike Bryan also welcomed a Leap baby, Russell, who was a week early.
He is 8 pounds, 14 ounces, and he was 21 inches. So he's pretty big.
Yeah,
he's pretty big for an early baby.
The Bryans say he's their 3rd baby, born just before 4 a.m.
I don't think we realized it was even like a leap year until yesterday.
Yeah, that's true.
So it didn't really dawn on us, I think, until like we were in the middle of the labor process.
Yeah.
The Parker twins were born right after Russell. Dad Anthony is a twin with a big family at home waiting to greet the new babies.
We got 2 more to add to the bunch that we already have. We have 5. And so this makes 6 and 7. Happy birthday, doctor.
Also celebrating a Leap Day birthday, Virtua OBGYN Erica Grossman.
Today I'm 13. My youngest of 4 kids is 13 years old, so I get to be the same age as my youngest kid. And that's the last time. After this, all my kids will be older than me.
He's actually 52 and happy to be working on his birthday.
I think February 29th is a unique day. So if I can be at work and deliver a baby or 2, that's a good day for me.
Health Watch will be right back after a short break. Welcome back. Here's more from this week's edition of Health Watch.
A new alternative to medication for high blood pressure is being tested.
So how's it work? Here's health reporter Stephanie Stahl to tell us.
This is very interesting new technology, guys. You know, it is estimated about 3/4 of people with high blood pressure don't have it under control, which can lead to life-threatening complications. Well, researchers are now looking at a one-time fix that could someday replace medications. When 69-year-old David Leifner was diagnosed with hypertension 8 years ago, doctors told him to change his lifestyle.
I tried to reduce the salt, the sodium in my diet, tried to exercise some more, and it didn't really make any difference.
The next step, a pill, but his blood pressure still didn't budge, so he enrolled in a clinical trial investigating whether a procedure called ultrasound renal denervation could safely and effectively treat hypertension. Here's how it works. A doctor threads a tiny catheter through the groin into the blood vessels that feed the kidneys and applies ultrasound energy to disrupt the renal nerves that contribute to hypertension. It's quick, minimally invasive, and patients are one and done.
The safety record is terrific. The FDA voted unanimously in terms of safety to approve the procedure.
Doctors say the procedure doesn't work for everyone, but on average can provide results similar to a good blood pressure pill.
For a long, long time, we had nothing new to offer. So for those of us who've been in the hypertension field, taking care of patients with blood pressure and really struggling, looking at the global rate of control, this is very, very exciting news.
4 years later, David remains off medication with good readings and couldn't be happier. Now, most primary care providers would still recommend lifestyle changes and medications before jumping to a procedure, but they say it could be a good alternative for hypertension that is becoming more and more widespread. Interesting
that's for sure.
option for people.
Oh, very much so. Very much so. Thank you, Steph. Good stuff.
Well, whether it's smoking, vaping, or eating, any use of marijuana has been linked to a higher risk of heart attack and stroke. A new study published in the Journal of the American Heart Association found daily users had a 42% higher risk of stroke and a 25% higher risk of heart attack. While non-daily users also had an increased risk, it was not as high. Of the marijuana users in the study, a majority said smoking was their most common form of consumption.
A vitamin that's added to many processed food items is linked for the first time to an increased risk for heart disease, according to new research.
Health reporter Stephanie Stahl breaks down this new study.
Most cereal, flour, breads, and processed foods are fortified with vitamin B3, which is niacin. It's also found in meat, fish, and nuts. But new research from Cleveland Clinic shows getting too much can increase the risk for cardiovascular disease.
What we found is that people who are in the top 25% of the population are getting too much. And they're making, as a result, some of these excess breakdown metabolite products that normally wouldn't even be seen in a healthy diet that was natural.
Dr. Stanley Hazen, who led the research, says it showed too much niacin can lead to an excess of a specific kind of metabolite which triggers inflammation. That can damage blood vessels. Because our bodies don't create enough B3 on its own, since the 1940s, the U.S. required niacin to be added to foods like cereal, flour, and oats to help prevent a vitamin B3 deficiency. But Dr. Hazen says since so many people now eat processed food, they're getting too much niacin. He hopes the new research will help change that.
One thing is it improves diagnostic tests to identify who is at risk for disease and needs to be the focus of where preventive efforts go. The second is by understanding it's involved, now we can begin to do the process of how do we intervene on this pathway.
Dr. Hazen says his research shows that people should try to eat more whole foods and limit or avoid processed items. Stephanie Stahl, CBS News, Philadelphia.
Well, eating too much protein could be bad for your arteries.
Yeah, so that is according to a new study from the University of Pittsburgh, where researchers found that getting more than 22% of your calories from protein can lead to increased activation of immune cells, and that plays a role in plaque formation. It's estimated about a quarter of the population gets more than 22% of all of their daily calories from protein. And people who eat a healthy plant-based diet are less likely to deal with dangerous snoring caused by obstructive sleep apnea. That's according to researchers in Australia who found that those who had diets high in vegetables, fruit, whole grains, and nuts were 19% less likely to have obstructive sleep apnea. But the researchers also found that people who ate an unhealthy plant-based diet high in refined grains, potatoes, and sweets were at a 22% higher risk.
Thanks for watching this edition of Health Watch. If you're enjoying this show, download our app, CBS Philadelphia, on your smart TV, Apple TV, Roku, or streaming device to catch us every weekend. And stay with us. There is much more to come here on CBS News Philadelphia.